So, as I said, my name is Courtney, and I am the coordinator of community outreach and engagement. And we're very thankful that you're here for our Let's Talk About for our social prescribing project. We'd also like to thank the RBC Foundation for sponsoring the Let's Talk sessions. So, I'm just going to go through a few housekeeping things, and then I'll hand it on over to Judy. So, just a few kind of simple housekeeping things. First is we'll ask that you mute your mic just to block any outside noise that you might hear on your end. If you need captioning, there's a button at the bottom so that you can have closed captioning so that you can hear the word, see the words. We ask that you put any comments and questions in the chat, and we'll go over those at the end of the presentation. And just so everybody knows, the session is being recorded, and it will also be posted on YouTube just in case anybody isn't able to make it today that would like to view it. We'd also just like to give a little mention here. Kimberly Leonard, our CEO, is with us today, who's going to be listening in, and we're very thankful to have her here as well. So welcome, Kimberly. And before we get started, I'd also just like to do a land acknowledgement. So we respectfully acknowledge the lands on which we live, work, and meet, and are situated on the traditional territories of the Indigenous groups of Newfoundland and Labrador. And we acknowledge with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. We honor the diverse Indigenous peoples who have cared for this land for past generations and for the 7 generations to come. We are committed to listening, learning, and working in collaboration with Indigenous communities as we move towards reconciliation, respect, and mutual understanding. Let us carry this acknowledgement forward in our work and relationships as we strive to create a future that respects and embraces the wisdom of older adults and the diversity of all communities. So before we get into the presentation, I just wanted to introduce our speakers and ask a few questions. So have you ever felt physically ill or anxious and depressed about something that is going on in your personal life? You could be in an abusive situation and ashamed to tell anyone about it. You could also be feeling this way due to loneliness, financial issues, poor housing, or no housing at all, and you know it's making you ill, but you don't know what to do about it. We're here to tell us about a project that's been spearheaded by SeniorsNL that can play a role in addressing some of these needs and supporting patients and health systems alike, is Judy O'Keefe and some of our link workers. So I'm just going to give an introduction to them and then I'll hand it on over. So first we have Judy O'Keefe. She's the provincial coordinator. Judy is a dedicated leader and health consultant with extensive experience in healthcare, social work, and community services. She holds a Master of Social Work and a Certified Health Executive designation and has committed her career to enhancing healthcare and senior care. As an integral member of Health Accord NL, Judy played a key role in redesigning community services, emphasizing improving access to team-based care while also addressing the social determinants of health. Her expertise has improved care models for seniors and vulnerable populations. Now retired from formal healthcare, Judy is the project coordinator for the SeniorsNL Social Prescribing Project. In this role, she promotes the integration of community resources with healthcare, fostering a more holistic approach to health and wellness. And with us today, we also have our link workers. So first is Heidi O'Brien. Heidi has worked in community support services for the past 2 decades with a concentration in recreation therapy and volunteer management. She graduated from Memorial University of Newfoundland and Labrador with a Bachelor of Recreation in 2003 and has spent most of her career in Ontario, working with clients, providing supervision to staff and volunteers within adult day programs. As the program supervisor with Victorian Order of Nurses, Heidi was actively involved with social prescribing practices, conducting personalized client assessments, and connected people with community programs. Heidi is passionate about community-based programming and supporting independence in older adults so they can live their best lives. Next, we have Julie. So Julie is a link worker in Clarenville. Julie is a link worker with SeniorsNL, and she is also a registered kinesiologist and CSEP clinical exercise physiologist. Most of her professional experience has been in the exercise and rehabilitation field, which brings to the forefront Julie's empathetic and caring nature, combined with the goal of improving an individual's overall health and well-being. In her spare time, you can find her outside enjoying nature, hiking, gardening, or on ATV, or exploring her creative side through arts and crafts and music. Julie is excited to be working as a part of this team to provide collaborative care to individuals age 50 plus in the Clarenville area. Next, we have Shelly. So Shelly is a link worker here in St. John's, and she has a background working within community for over 20 years, a degree in gerontology from St. Thomas University, and a registered social worker. Shelly has an extensive experience working with individuals across the lifespan using a trauma-informed and empowering approach. She also has a particular interest and passion for mental health and currently sits on the mental health advisory for the province of Newfoundland and Labrador. When not at work, Shelly enjoys spending time with family and hiking some of the East Coast beautiful trails. She is thrilled to be working in collaboration with the NLHS on the Social Prescribing project and to be back with her roots at SeniorsNL. And then last but not least, we have Bethany Roberts, who's a link worker in St. Anthony. So Bethany is our newest link worker and brings a wealth of knowledge and experience to the team. She holds a Bachelor of Arts with honors in Global Development Studies from Queen's University and is currently pursuing a graduate certificate in mental health and addictions from St. Lawrence College. Her impressive background includes extensive community and volunteer experience in areas such as tourism, guiding, outdoor sports, and even engineering. Bethany has expressed her desire to work with an organization committed to creating a meaningful impact and making the world a better place for everyone. We are confident she has found the perfect fit with us, and we're excited to have her join the team. So I will hand it on over to Judy. Just give me one moment there.
Okay. Thanks, Courtney, for those introductions, and thanks everybody for joining us today to hear about our project. We're really thrilled to see many of you here and to share this exciting initiative with you. The project is a collaborative effort between Newfoundland and Labrador Health Services, SeniorsNL, as well as the Health Transformation Team with Government of Newfoundland and Labrador. And being supported by Health and Community Services and Children, Seniors, and Social Development. It's a 3-year project funded by Walton Trust, and it ends in June 2026. And just to say about social prescribing, it certainly is a proven approach across the world. It's inspired by the link worker model in the United Kingdom, and it integrates social supports into healthcare. It addresses the social determinants of health, which are really the non-medical factors that affect our well-being. Next slide.
Just bear with me one moment there, Judy. I'm having a little bit of I'm just gonna, just one moment there.
Okay.
Let's try this again. There we go. Sorry about that.
No sweat. So this is our agenda that we're going to cover today. We're going to try and keep lots of room for questions at the end. But essentially, we'll provide an overview of the Social Prescribing Project, what it is and why it matters. We'll talk about the importance of addressing the social determinants of health. We'll provide some examples of how link workers help and the benefits of social prescribing, and then we'll conclude with our question and answers. And I know that we're capturing any questions or comments in the chat, and we're going to save the most of our discussion for the end, but certainly if there's questions that come up along the way, Courtney and team will let us know if we need to pause and address those. All right, we'll move to the next slide. All right, this is our team, our fantastic team that we have working here with us in our social prescribing project. Courtney gave a very extensive overview of everybody's background, so I won't repeat that. But I will tell you where folks are. So I think that might be important for most of the people online now to know where the link workers are located. So we'll start with Heidi. Heidi is based in St. John's. And she's actually working with 2 family care teams, Metro and Center. And so she has, Heidi's our senior person, actually. She's been around the longest. And so she's working with 2 teams there. Julie Saunders is here in the middle. Julie is based out of Clarenville with their family care team. And Julie will be extending outreach as well to the Bonavista team. So we do have rural, great goals in terms of extension to rural. Shelly Collins is also based in St. John's. Shelly is one of our newer members of our team, And Shelly is going to be working with the family care teams east and west. So the team that's on Topsail Road and the team that's on Majors Path. So in St. John's in total, we will have 4 of the family care teams that will be covered by both Heidi and Shelly. And then Bethany Roberts. Bethany actually just started with us. She's actually hasn't even completed orientation yet, so she's brand new, and we're very excited to have her. She's located in St. Anthony, and she will be providing outreach to both Flowers Cove and Roddington as part of her work. And again, you met me. I'm the project coordinator. And prior to my coming to the team, Dr. Suzanne Brake was the social prescribing coordinator. And many of you I know would know Suzanne from her work with the Seniors Advocate Office. So we're very excited now to be working with you. We also have plans to add 2 other team members. And we're working with the health authority to identify the location of those 2 new link workers that will come on. So we're very excited, and we're hopeful to have a full team before the end of this calendar year. And with that, we're hoping to extend the work certainly to others. Next slide. Okay, so we'll just give you a little rundown on social prescribing. So, as we have here, social prescribing is really, it's a global initiative, but it's a way to connect to individuals to non-clinical support and community resources that improve their overall well-being. And when we talk about non-clinical support, we're used to in the health system, going to see our providers and having a prescription for, maybe a pharmaceutical prescription. It may be diagnostic tests. It may be, seeing a therapist. There's all kinds of things that happen when we come to the health system and we need. What we're doing in social prescribing is looking at what are all the other parts of the social health system that can support us to remain healthy and well. The model itself began in, like I said, in the United Kingdom in the 1990s, but it's now a very key part of healthcare systems in well over 20 countries, including Canada. And in Canada, it's very well established in Western provinces and Ontario, and now in Nova Scotia as well. And now in our own province, of course. The Health Accord NL actually recognized social prescribing as an innovative way to address the social determinants of health and improve team-based care. So that 10-year plan, the Health Accord, certainly speaks to social prescribing and the importance of having both sides, the yin and yang of health and well-being. So there are things that we need to have to keep ourselves healthy, but there's things that we can do ourselves to monitor our own health. For this reason, we do our work in very close partnership with the family care teams and our family physicians as well. Worldwide, we certainly know that social prescribing is very significant, and we know that the social determinants of health are a very important part of staying well. We know that, for example, unmet social needs are linked to a 29% increased risk of heart disease, for example, a 50% increased risk of dementia, and certainly significantly higher rates of mental health challenges. So for us to guide our project, we also have a provincial advisory committee. The provincial advisory committee includes members from SeniorsNL, Newfoundland Health Services, government departments, and also Quality of Care NL. And the group ensures that the project aligns with provincial healthcare goals and also the funders' expectations. And we provide regular reports to Walton Trust in terms of our agreed expectations around goals, onboarding of clients, and the amount of support that we expect to provide. The overall goal here, of course, is to engage family care teams across the province in social prescribing. And as I mentioned earlier, we currently have 6 family care teams with outreach to 3 more active. We're halfway there, but we plan to expand even further by the end of the year to include central and western zones. So for anybody who's on living in those parts of the province, we do intend to provide support in those areas as we move across. And we're also exploring other ways that we can extend service delivery, for example, looking at virtual care options that we can provide. Another significant goal, of course, is to refer older adults to community support by the end of the project. And so far, link workers, so far this current half, we've assisted between 40 and 50 older adults, and we continue to spread the word about the project. The first year of the project was certainly developmental, and this year we're into the implementation phase of the project. So we anticipate many more hundreds of older adults to be supported before the end of this year. And finally, our goal is to conduct a thorough evaluation to measure the impact of social prescribing on not only the individuals that are being supported, but also on the healthcare system. So we'll be looking at things like seniors' health and wellness, whether they felt that social prescribing helped them improve their lives. And also we'll be looking at the impact on the healthcare team. So did having the link workers involved in providing this care support the work that they were doing? Were they able to concentrate on other work and then provide, augment the services that they're providing through the link workers? And then we'll also be looking at things like, did it reduce the number of visits, for example, to the emergency room because people, their other social issues were being dealt with. And so that's really the goals of the project. And at the end of the day, one of the things we really want to explore is how we can successfully integrate social prescribing as an approach into the healthcare system. And that's something that is coming out of the Health Accord, the need to marry social and medical care. Next slide. So this is a definition of social prescribing from the Canadian Institute for Social Prescribing. And anybody who wants to read more about social prescribing, I'd certainly encourage you to just do a search of CISP, and you'll find lots of tools and videos and other resources to describe, what it is and actually examples of how it's functioning in other parts of the world and in Canada in particular. Also, our Newfoundland project is part of a community of practice around social prescribing. So we also meet with other groups across the country to talk about what's working, to share ideas, and to really reflect on, how we can improve the project as we move forward. So what is social prescribing? Social prescribing really acts as a bridge between formal healthcare system and community resources. But at its heart is the link worker role. These dedicated individuals connect people to programs and supports that align with their interests and needs. Examples of social prescriptions might include joining an exercise class. It might be participation in a bereavement group. It might be connecting somebody to food security, getting a food hamper. It might be exploring local hiking trails with a group of peers. There's all kinds of things that would come under the general category of social prescribing. And really, social prescribing it's a mindset shift. It's talking about what matters to you instead of what's the matter with you. So it's about what's important in your life that helps keep you well, as opposed to focusing on the disease or illness or things that aren't going well in your life. And it really puts the individual back in control of being able to develop their own plan for wellness and being able to focus on how they can work with the community to have full social lives. Okay, next slide. So we talk a lot about the social determinants of health, and I'm sure a lot of you have heard that, both in the media and certainly through the government in terms of the health transformation that we've been talking about for some time. But again, really, when we talk about the social determinants, we're really speaking about those non-medical factors that influence health. And they're the conditions in which people are born, grow, work, live, and age. And some of them include things like income and financial security, access to safe and affordable housing, education, and also social inclusion. And that's where we come into for social prescribing. It's about the connectedness that we have in our lives. Evidence shows that social determinants account for between 30 and 55% of our health outcomes. So even more than the healthcare side. And it outweighs the influence of healthcare or even lifestyle choices that we make. Specifically, when we talk about the social determinants of health, we know that loneliness, for example, has a significant impact on health. And that's one of the critical issues that we're trying to address with social prescribing. And for older adults, we know that older adults are more at risk of loneliness because of losing circles of friends and family, perhaps being disengaged from the workplace or not being able to participate in social events because of, a host of different reasons. When we talk about loneliness, though, just to give you some idea around the actual impact and how serious it is. And I will say, interestingly enough, in the UK, they actually now have a minister responsible for loneliness and trying to prevent and support individuals around that. They recognize how important this issue is to healthcare, and enough so that they have a ministerial appointment around it. So I think that's pretty significant. I don't know that if that's where we need to be, certainly, but I'm very happy to see a focus on the social determinants around that. We know that loneliness can cause a 29% higher risk of heart disease, a 32% increased risk of stroke, 50% increased risk of dementia, and a 60% increase in premature death. So, these are the statistics that are scary when we talk about, the social factors that affect our lives. And it reinforces the importance of addressing these factors holistically, and by doing that through social prescribing. Next slide. So this slide is just to show you some of the social determinants. And when we talk about social prescribing, for the most part, overall, we touch on all of these areas. We specifically touch on some of them more than others. So certainly, as we hear from Shelly and Heidi and Judy, they'll be able to provide more examples of how link workers support individuals when we talk about the social determinants. But for example, specifically for the population that we're trying to support here with SeniorsNL, we look at things like food insecurity. Do seniors have enough financial means to ensure that they have access to good, healthy nutrition? Can they get to grocery stores? Is there transportation to access food? Access to healthcare. We know that in this province right now, a lot of people are struggling to access healthcare. But as you get older, oftentimes you need to ensure that your healthcare is wrapped around you, because that's when we start to see the complexity of chronic disease and other things that may require one to need really secure, holistic care. Income and social protection is another one. When we look at, the number of seniors in this province that are, living really probably check to check. And so their capacity to engage socially with the things that they might like to do, to attend groups and events, to pay for transportation to go places, to pay for supports like that might be a barrier. And then also, finally, social inclusion, which is probably one of the bigger things we talk about. It's having the ability to be involved in the things that bring you joy. So to be involved in groups, to see your friends, to attend classes, to, go out and go to the mall and, meet your friends. So things like that might be a community garden. But there's lots of things when we think about social connection and social inclusion that are extremely important to the older adult population, to keep us part of the community. So there's lots here. We could probably with the exception of early childhood development, we could probably talk about all of them in detail right now, but we'll move on. Next slide. Okay, so I just want to talk a little bit about the benefits of social prescribing. And as you can see here from this particular slide, it benefits both the individuals that are, let's say, the clients or the users of the social prescribing system, but it also benefits the health system. And what it does is really help people to build meaningful connections, linking clients or seniors to valuable community resources. It promotes autonomy because it allows you to judge what works for you and to really develop a plan in conjunction with your link worker to support you. You're in charge. It gives people a sense of purpose and it empowers them to manage their own health. So suddenly it's not your provider, your healthcare provider saying what's right for you. It's you saying what's right for yourself. It reduces healthcare usage by addressing the root causes of health issues. And finally, it supports person-centered care. And when we talk about that, we talk about tailoring the support to each individual's unique needs and goals. Everybody is different, and what works for me may not work for somebody else. So that's why it's so important for me to be involved and for me to have a say in what's right for myself and to build that plan with the link worker. Social prescribing is especially impactful for seniors because they often face social isolation and reduced mobility. And by connecting older adults to community activities, it helps seniors to maintain their independence, improve their mental well-being, and enhance their sense of belonging and quality of life. And ultimately, it improves quality of life by addressing those broader social determinants that we just talked about. All right, that is the end of my slides. And now I'm going to hand it over to Shelly for the next slide. Thank you, everybody.
Thank you, Judy. Hi, everyone. Can you hear me okay? Someone give me a thumbs up, maybe. Wonderful. Thank you, Judy. So I'm going to talk a little bit about what is a link worker. And Judy did a really great job at explaining what the project entails. But a link worker works in collaboration with the family care teams to help bridge the gap between health and social care. And I'm just one of several in the province. And as Judy mentioned, Heidi and Julie are the other link workers that are online with us today. And we also have Bethany, which has newly joined us, that are employed through SeniorsNL and work directly with these teams. And how this works is through referrals from members of the family care team. So that could be a doctor or a nurse practitioner, social worker or OT, or even a dietitian. They will connect individuals to us directly through referrals. And then we connect them with support and resources, assisting with identifying some barriers to support that may exist. As link workers, we start this conversation by getting to know what matters to these individuals. And as Judy mentioned, every individual is different, what their needs and what their goals may be. And that's why the relationship building is so important and so key as part of this collaboration, as part of this team. By understanding a client or individual's priorities and interests, as link workers, we can provide support to individuals by ensuring these referrals are made to the appropriate community-based resources or services based on the individual's needs, and follow-up is needed. And that's what's wonderful about being employed through a community organization like SeniorsNL, because we do have access to up-to-date, appropriate community resources. And we have that support that can help us locate it if, there is a gap there as well. And at the end of the day, the goal is to empower and to encourage individuals to take charge of their own health and well-being. So that's just, I guess, a little overview about what we do under that umbrella. And next slide, please, Courtney. And I'm just going to talk a little bit about what a link worker can provide to you. And as I mentioned, it really does vary depending on what the individual's needs may be. And some examples of this can include referrals to community groups, social groups, recreation programs, information on community events that they may not know may exist if that's what they're looking for. I know, and I'm fairly new to this project. Well, actually, a couple weeks in, I say fairly new, but I know Heidi and Julie can talk a little bit more about some of the excellent work that they've done. But assistance with filling out forms, like spending the time with the individuals, because that quite often can be a barrier in itself, like knowing that these programs exist, but having the actual form to help them fill it out, which may include the Aging Well at Home grant or the home heating supplement forms, just to name, several, and assist them with housing or food insecurities. And this is just to name a few, because again, it's up, it's up to the individual, like what they're looking for. So these are just, a few examples of some of the things that we can provide support with. And that's it for me. I think I'm moving it along to Heidi now, I believe. So next slide, Courtney. Thank you, everybody.
Thank you, Shelly. So as we will say again, and we can't say it enough, really, the question, what matters to you? And that is what we ask every individual we speak with. What really matters to you? What is important to you? And when we work with the individual, we get to know them. It could be a 5-minute conversation. It could be a 45-minute conversation. It really could even be an hour and a half. Depends on how much they have to share and how comfortable they are with us. But through that conversation, we, with their help, create a personalized wellness plan. And it's based on the needs of the individual. They let us know what their interests are, what their likes and dislikes, what they used to do, what brings them joy, what they'd like to get back into, and, really what they miss. And then they learn and they remember really what is important to them and really what does matter to them. Next slide, please. So here's an example of our wellness plan that we develop with the individual we meet. Just some at the top of it is more like demographic information that is needed more for the EMR when we upload to their file. And then we look at, what is your story? What do people need to know about you? What do they want to share? Again, what matters to you? And then we look at what isn't, like, develop an action plan with them, set some goals with them. What are some attainable goals? What do they feel they can handle in their present time? I have one gentleman that I work with, and he said, are you going to get upset if I don't attend a certain group? Because he has all these goals set for himself, but we want to make sure they're all measurable and that he can actually follow through with them. And I told him, of course I'm not going to be mad, and I work with him and will continue to work with him and encourage. And that's, I think, the big job of a link worker, is really to encourage. And we talk about promoting independence and helping them along their journey. Once the wellness plan is developed, then it is sent to Clerical, and they will then upload into their medical record. Next slide. The referral process. So there's 2 different ways to refer to a link worker. One is a self-refer, and they can, we have obviously a number and email. So that is located at the clinic. And if the patient is attached to that clinic, obviously, they can self-refer, they can give us a call, and we can start the process. Or they meet with someone on the family care team, and it is recognized, the need is recognized by the provider. Again, could be nurse practitioner, dietitian, social work, anyone on that team recognizes that there's a need for them to meet with a link worker, and the patient is in agreement with that. They give their consent. Then a referral is sent to the link worker, and we then start that relationship, start that connection, give them a call, and then we either complete the whole process over the phone. We can complete it in person, meet them. They can come to the clinic, or we can meet them in the community. It could be go out for a coffee. It could be even meet them in the park. I know Julie's met someone in a park before. So whatever they're comfortable with is really what we try to do. A wellness plan is created, it is uploaded into their EMR, and then a follow-up plan is established. And we usually give them, we give them homework to do. So they usually let us know if they're comfortable making these phone calls, or, we've created a plan and give them some resources, and they want to do the follow-up and make the phone calls and get started. And then we tell them, we'll touch base in a week, we'll touch base in a couple weeks. And sometimes they suggest, well, give me a month, see how it is, and then call me. It's really, we compromise and we work together with the individual, but a follow-up is always as part of the plan. And I think the next slide is for Julie. I'll pass it on to her. There you go. Thank
Awesome.
you.
Thank you so much, Heidi. So now that we all know a little bit more about social prescribing and the role of link workers themselves, I just wanted to talk about a couple specific examples of referrals that I've received so far. So as you can tell by now, the role of the link worker is very broad. So we do get a wide variety of types of referrals. The type varies, like we said, based on the individual's needs, and we do receive complex referrals that sometimes encompass multiple different areas within our scope. So one example of a type of referral that we receive is assistance with various forms. So I know we kind of touched on that point before. So you can see a couple examples here on the screen. So with regards to forms, we can assist with confirming the eligibility for various programs, as well as assisting completing the form itself. We can also assist, say, if the form requires postage, we can help with that, or online submission. So various different things. You can see a couple examples there on the screen. So the Newfoundland prescription drug program, disability tax credit forms, as well as a couple that were mentioned earlier as well. So another example you see here on the screen, so a widowed individual moved back to an area after 50 plus years away and hasn't done anything outside the home in the last 2 years. So the main reason for this lack of community involvement was simply not knowing about what programs existed. So she had been away for so long, she didn't really know, and she wasn't sure how to find out the information on those programs that exist. So this individual specifically, we actually met at a community park. So obviously this park was not established when she was there previously. So we did a tour of the park, looked at different amenities, and there's a bowling alley in the area. There's a chalet where a lot of the seniors programs occur. So we were able to kind of just show her those amenities so that she knew she was more familiar with the area. I also linked her back with volunteer opportunity with an organization she was actually volunteering with previously in the other community she was living in. She also has joined a 50 plus club, and I also introduced her to an indoor walking track. So walking for her was one big thing. And like we all know, in the winter, it's a little bit tougher getting outside. So just give that ability to get her out of the house in the winter months as well. So down the bottom, just one more example. So a man seeking volunteer in group activities to help with feelings of isolation and loneliness. So this is the type of referral we do receive fairly often. Like I said, isolation, loneliness. In this specific example, his wife had health concerns, so she's now in a home. He's living on his own in a seniors living community. So it's been taking some time to kind of just adjust if you're used to doing something with your partner or your spouse and then doing things on your own. So this individual actually has joined a weekly bowling league, and he reconnected with a couple individuals he hasn't seen in 20 plus years. He's also been attending card games regularly 1 or 2 times a week. He's also been volunteering in a retirement home in the area. So even all those small things and the feedback from him it's made a huge difference in his life, just getting him out of the house. So even adding a couple regular activities, like these don't seem like small commitments, you know what I mean? It might be a couple hours, a couple times a week. I find it just helps establish a schedule. You have something to look forward to day, and then it also gives you a sense of purpose. Also, as we mentioned, we do handle more complex cases. So some of these may involve like housing support, income support, food insecurities, just to name a few. There is really a wide variety of the types of referrals that we do receive. So I do find like the overall take home message from this is that each individual case is different and our approach may vary case to case. But at the end of the day, really the overall goal is to provide the ongoing support, the information, and referrals to help these individuals live a happier and healthier life. Next slide, please. So one of the amazing things I've found about this job so far is really how rewarding it is. Like you're making a difference in people's lives, and it's hearing that positive feedback. So basically, I just want to share a couple quotes from individuals that I've heard so far. And I find it really puts in perspective the effect that social prescribing has had on their lives. So my personal favorite, the top one, everybody should have access to a link worker. So this is one that I've heard actually a couple times. But it just really shows, like I said, the effect that the social prescribing and the link worker has had on these individuals so far. And I'm looking forward to being able to help a lot more as well. So my link worker helped me, participate in regular weekly activities. I'm very grateful for her ongoing support. So as Heidi mentioned, like we provide ongoing support. It may be weekly, it might be bi-weekly, it might be in person, it might be over the phone, it might be at the family care team, or it might be in the community, or some combination of all. So I find the great thing about this position as well is it does allow for that flexibility to accommodate the individual needs of each person. And the third one there, it's amazing how much the community has to offer that I didn't know about before meeting with the link worker. So that's also a very important part of our role, is really being informed. So knowing what programs and services exist, so then we can share that information with the individuals that we work with. Next slide, please. All right, so I just want to say thank you all for your time, and we'll open up the floor to any questions.
Thank you so much. Mary, I'm going to hop over to you. I know you were monitoring the chat there. Are there any questions in the chat, or if anybody wants to hop on and ask anything?
Actually, there are no questions in the chat, so maybe we could open the floor, and if someone has their hand up, Tom.
Thank you very
has his
much.
hand raised.
Yes,
Tom,
thank you very much.
Yeah.
Thank you very much. I really look forward to a conversation we will be having next week. But I have a question right off the bat, right here. It was a wonderful presentation, and I can't just say how much I love this idea and how much I love the fact that it's being implemented in our province and region. One big question that comes up all the time is, what do people do in general who fall in between the cracks of the current healthcare system in terms of not having a family doctor, or not even having, or maybe having a family doctor but not having access to a family care team that looks beyond the medical prescribing situation? How do people in communities access that wonderful service if they don't have that? What are there any avenues as of yet? And I'm not criticizing the system at all. You got to start somewhere. I know that, but is there any way that those people, loners and left alones, or not being currently cared, can access that service as of now already?
Judy, you are muted. Do you want to respond to that?
Yes, certainly. Thanks, Tom. And I think that's, since my time with this project, I certainly identify that as a concern. I mean, there's huge need across the province. And we know that the need has gotten significantly greater when we think about people's lack of access to the formal healthcare system as well. And with all of the other social pressures that have come on for older adults, I think it makes it, the need for social prescribing that much more pronounced, perhaps is the right word. But, the project itself, and the funding around the project itself was limited to the link workers being embedded in family care teams. And actually, the original proposal was that they would be embedded in 5 family care teams across the province. So we recognize that's an issue. There's huge gaps because the formal healthcare system is also struggling with attaching individuals to services. So we're working together on that, but we're also trying to bend the rules, but kind of maybe that's not the right approach, but kind of ensure that we're opening up access as much as we can while still staying true to the agreed upon the funding agreement with Well and Trust and with the other partners. Some of the ways we've done that is looking at how we can explore extension of support. So, for example, in Clarenville, one of the things that Julie's involved in now is working with the family physicians that are out there that aren't attached to a family care team, but what are some of the things that they're seeing and how she can provide some support to their patients. In terms of the other family care teams that are coming on, there is potential to extend. There's also potential to work with community groups to identify community assets, identify ways that we can support other adults that are out there. And of course, SeniorsNL themselves. I mean, to try and, as we're working with groups and identifying resources and, working with the team here, then as people call SeniorsNL with questions to the information and referral line, then they can be supported as well. So there's an individual who's not attached to a family care team can still call SeniorsNL and ask for support. But they may not get the services of a formal link worker, although we do have a very robust team here and volunteers. So I guess the short answer is, Tom, that we're working on identifying where those gaps are and trying to fill as much as we can while withholding the principles of the agreement. And that's probably as best we can do right now. My hope, I would say, we probably don't need to prove the social prescribing works because we know it works. We know that it's proven across the world. My hope is that, we can then say this needs to be embedded into the formal health and social care system. This is something that is incredibly important, especially to older adults, and it needs to be funded on the long-term basis. That would be my hope.
Thanks, Judy. Carmelita had a comment she'd like to make.
Hi, everyone. I just find this so interesting this morning because it's something I've been advocating for years, actually. And I work with several different seniors groups here on the west coast of Newfoundland. And I'm a yoga and mindfulness teacher. And I offer yoga and mindfulness to, I would say, about 100 or more people every week, and the majority of them are seniors. And I could go on and on about the benefits that they have been receiving from these group meetings, and so many, like you said, even just the social aspect of getting together, and sometimes we have we'll stop at the end and have a little luncheon, and people can sit around and talk. And another thing is, so many seniors don't move their bodies, and you know what? They think that they can't. I mean, when I started teaching yoga to seniors, they really didn't believe they could do yoga. They thought yoga, they had this different connotation of yoga, like it's for young people, it's for people of a certain size, of a certain age. And we're just blasting that out of the water now, because I'm telling you, some of these seniors that I learned so much from them. just as much, sometimes more than they learn from me. And I have people from 50, because it's like 50 plus who I offer it to. A lot of them are seniors groups, seniors clubs, and right on up to 87. And, again, I don't want to take too much time, but there's so many pros. And I'm so excited that there will be a link somewhere on the West Coast, because I would love to chat to them. And this social prescribing, I think it's been a long time coming. And, I and some of my other colleagues have been putting the word out there to clinics and to government members and representatives that we need this. Seniors need it and they deserve it. And we want to see more of it.
Thank you,
Thanks.
Carmelita.
Thanks, Carmelita. That's one thing, putting the word out and letting people know what you know about link workers and social prescribing is a really good way to encourage people to want to have more of it, to participate more. Anybody else have a question or a comment? Back to you, Courtney.
Perfect. Thank you, Mary. Again, what a wonderful project and a really great presentation. And it's such good information for all of us to know. So before we finish up, I just have a couple of quick housekeeping things. So I'm going to go ahead and switch over to my final slides here. Just bear with me. Okay. Okay, so if you need a certificate from this presentation, you can email me at outreach@seniorsnl.ca. So if you need that for professional development, just let me know. If you're interested in being a friend of Seniors NL, so just a little bit about that. Friends of Seniors NL is an intergenerational opportunity to engage people of any age in the well-being and independence of older adults. Friends of Seniors NL will be given business cards to distribute to those they feel can benefit from Seniors NL information and referral service. They will also have opportunities to attend presentations or workshops that Seniors NL might have in their communities. So again, if there's any interest in that, you can email me there at outreach@seniorsnl.ca. And then just about our next Let's Talk. So coming up next is going to be on December 4th, and we're going to discuss budgeting at Christmas, and this is going to be with Al Antle. So probably by the end of today, you will get an email with the link to the next Let's Talk About. And again, that will be on December 4th, and you should get that by the end of today. And then again, here's our main email, so info@SeniorsNL, and there's also my email, outreach@SeniorsNL, if any questions, if you need that certificate or any interest in any other questions or comments. So with that, I will stop sharing. And again, just want to thank you all for that presentation. Really, really good stuff, really good for everybody to know. So thank you, everybody. And if there's no more questions or anything, we will finish up there for today.